Alicia. I'm going to be your student nurse today.
Okay.
How are you?
I'm doing great.
How are you feeling today?
Pretty good.
Good. Okay, I'm just going to wash my hands.
Okay.
Do you have any allergies that I should be aware of?
No.
No. Are you having any pain today?
No pain.
No? Okay, good. Can you tell me your name and date of birth?
My name is Michael Shapansky, and my date of birth is April 1788.
Okay, good. Checking that with the armband. The patient appears to be their stated age. His speech is fluent, it's efficient. He's not hyperverbal, he's not slurring his words. His hygiene is good. He doesn't have any noticeable body or breath odors present. His mood is congruent with his affect. His posture is calm, relaxed, which is also congruent with his mood of being good today. I'm just going to do a head-to-toe assessment on you.
Okay.
It's just going to check your overall health and find any abnormalities today.
Okay.
So I'm going to start off with checking your head, checking for lesions. There's no lesions, no protrusions, no soft spots. The hair is distributed evenly. It's thick, it's shiny. Checking the temperature of the face. He's warm, there's no diaphoresis, he's not pallor, his skin color is appropriate to his ethnicity. There's no visible lesions, the face is symmetrical. His facial structures are also symmetrical. His eyes are symmetrical. I'm just going to check your pupil. So just go ahead and look straight forward. Good. 3 millimeters bilaterally. Good. Can you look at my pen?
Mm-hmm.
And follow it. Good. So his pupils are round, equal, reactive to light and accommodate. His sclera is white. There's no redness, no discharge. I'm just gonna pull your eyes down. The conjunctiva is pink. It's not pale or red. Good. Just gonna check the mouth now. The lips are pink. There's no redness, no swelling, no lesions. And open up. Stick your tongue out and say ah. Good. The uvula is midline. It vibrates when he says ah. Keep opening your mouth. The tongue is pink. There's no ridges or cracks. The oral mucosa is pink and moist. There's no cavities. Go ahead and go like this. Yep. Gums are pink. There's no bleeding or swelling. The teeth are white. The tonsils are not enlarged or inflamed. I would grade them a +1. Now I'm going to touch it here. Tell me if you can feel it.
Yep.
Here.
Yep.
And here.
Yep.
Good. I'm going to have you smile and frown. And now puff out your cheeks. Good. Cranial nerves 5 and 7 appear to be intact. Good. So now I'm going to check your carotid pulse. Good. So +2 on the right side. There's a +2 on the left as well. Now I'm going to listen for bruise with the bell of my stethoscope. Good. Good. No bruise detected. Now I'm going to check the upper extremities, looking for lesions. If there were lesions, I would do the mnemonic ABCDE test to test for abnormalities. Now I'm checking the temperature. He's warm, dry, no diaphoresis. Color is appropriate for ethnicity. The hair is distributed evenly. Okay, I'm going to check the brachial pulse. And it's +2 bilaterally. Now I'm checking the radial pulse. Also +2 bilaterally. You can go like this for me. Good. Checking the fingers. There's no jaundice, no cyanosis. The fingernails are not discolored. They're strong. They're not brittle. Checking for capillary refill. It's less than 3 seconds. There's no clubbing. Can you go ahead and squeeze my fingers for me? Good.
Okay.
The strength is equal bilaterally. Good. Okay, now I'm going to listen to your heart. So I'm starting at the right sternal quarter, the second intercostal, listening to the aortic. Good. Now I'm on the left, second intercostal, listening to the pulmonic. Now at the third intercostal, I'm listening to herbs. The fourth intercostal, I'm listening to the tricuspid. The fifth intercostal, I'm listening to the mitral. And this is where I would listen for the apical pulse for 1 minute. And the apex is where you would hear S1 the loudest. And S2 would be the loudest between the pulmonic and the aortic at the base of the heart. Now I'm going to go backwards to listen for murmurs with the bell of the stethoscope. So starting with the mitral, going up to the tricuspid, herbs, pulmonic, and then aortic, and no murmurs are detected. I'm going to listen to your lung sounds now, starting on the anterior, and just breathe normally for me. Good, no crackling. The lung sounds are clear in the anterior side. I'm going to have you face this wall here so I can do the posterior and lateral side. I'm going to do the lateral. Good. Lung sounds are also clear posteriorly and laterally. Now I'm going to check the anterior posterior ratio. And it's 1 to 2. He doesn't appear to be barrel chested. I'm going to percuss the costovertebral angle. Let me know if you have any pain or tenderness.
Okay. Nope.
No.
Nope.
Good. Now I'm going to check the spine for the curvature of it. So go ahead, lean forward for me. Good. There's no S curve. Doesn't appear to have scoliosis, lordosis, or kyphosis. May I have you lie down on your back? And then assess the abdomen. Go ahead and pull your shirt up for me. Good. The stomach appears flat. It's not rounded, protuberated, or scaphoid. It's symmetrical when he's breathing in and out. The umbilicus is midline. Okay. I'm checking for lesions. And he has a large scar on his upper left quadrant. I measured it, it's 15 centimeters. It's not red, it's not swollen, there's no discharge, it's intact. And when did you get this scar?
I had it when my spleen was removed. I was in the 2nd grade, and I had no issues with it.
Okay, and why did you have to have your spleen removed?
Oh, my spleen was enlarged.
Okay, and have you had any problems since?
No.
No, okay.
No problems.
So now I'm going to auscultate and listen for vowel sounds. I'm going to start in the lower right quadrant. Moving up to the upper right quadrant. Moving to the lower left, or the upper left quadrant. And now down to the lower left quadrant. And there were vowel sounds present in all 4 quadrants. If I didn't hear any vowel sounds, I would listen for 5 minutes in each quadrant. So now I'm going to lightly palpate and just tell me if you have any pain.
Okay.
So starting in the lower right quadrant, this is where the right spermatic cord and the appendix are. The upper right quadrant has the gallbladder and the liver. And then the upper left quadrant would have the spleen, and it has the stomach. The lower left quadrant has the left spermatic cord and the sigmoid colon. Good. Cool. Okay, you can go ahead and sit up for me.
Okay.
I'm going to check the lower extremities for discoloration, lesions. Doesn't appear to be lesions. The hair growth is distributed evenly. The skin color is appropriate for ethnicity. Checking the temperature. He's warm, he's not diaphoretic. I'm checking for edema now. Good. He doesn't appear to have edema. There's no pitting. If he did, I would grade the pitting. Checking the posterior tibialis pulse. And it's a +2. And now the pedal pulses bilaterally. And they're also +2. The feet, the toes are not discolored. There's still no cyanosis. Now I'm going to do the Babinski test. Good, and it's negative. I'm going to have you get up and you're going to walk to the back corner of the room and then come back. And now, did you get dizzy at all?
No.
No dizziness, didn't lose his balance, so that was good. Now I'm going to do the Romberg test with you. So what you're going to do, you're going to stand with your feet a couple inches apart, hands at your side. You're going to close your eyes. I'm going to do this for 20 seconds. And he didn't lose his balance, so the Romberg test is negative. Good. Thank you.
You're welcome.